Topic is Guna Parignana, that is, the properties possessed by the Dravya are nothing but a Guna. The therapeutic utility of these property of a Dravya, how they are reason for the treatment, we will see now. So firstly, Guna, the word Nirukti is Gun Amantrane, Gunyate Amantrane, Loka Anena iti Gunaha. So the thing through which the Loka will perceive the Dravya Gnana is nothing but the Guna. So what are the Lakshanas this Guna is possessing? Samavayi tu nishcheshtaha karanam gunaha. In Charaka Sutrasthana first chapter, he said that Samavayi, the guna is present in a dravya with a Samavayi sambandha tu nishcheshtaha, which is divide of a cheshta. It doesn't have any cheshta, and karanam gunaha, it is a reason for action. Then according to Karikavali, Ataha dravyashrita gneya nirguna nishkriya gunaha. Ataha dravyashrita, it is present in the dravya. It takes ashraya in the dravya, and it is itself is nirguna and nishkriya without a dravya. Vishva lakshanam gunaha, according to Rasa vishesha. The various characteristics are nothing but the gunas. Guna Sankhya. So how many number of gunas are there? Then anything in varied characteristics are guna, we have already said now. So what are the different gunas that are accepted by Ayurveda for use in the treatment? Those are Sartaha gurvadayo buddhi prayatna anta paradayaha gunaha prokta. So Arta guna, Sa Arta is nothing but Arta guna, indriyartha 5 in number, shabda sparsha rupa rasa gandha, aatma guna, Adhyatmika guna 6 in number, Paradi guna or chikitsa upayogi guna 10 in number, Guruvadhi Guna or Sharirika Gunas are 20 in number. So totally Ayurveda accepted the 41 gunas. First one, then classification. How this guna is classified? What is the infrastructure to classify these gunas? Guna is mainly classified into Adhyatmika guna and Adhibhautika guna. Adhibhautika guna further classified into Samanya guna and Vishesha guna. Vishesha guna are nothing but the Artha gunas. Samanya guna is further classified into Guruvadhi guna, or also called as a Sharirika guna, and further classified into Paradi guna, also called as a Chikitsa Upayogi guna. Next is the Guruvadhi gunas. First, according to Charaka, according to Vagbhata, according to Sushruta, we have a difference of opinions. Whereas Charaka and Sushruta mentioned 20 gunas only, and Sushruta added some more new gunas, and he mentioned the 23 gunas. So what are the gunas mentioned by the different authors? We will see now. First, according to Charaka Sutrasthana 26th chapter, Guru Laghu Shita Ushna Snigdha Ruksha Manda Tikshna Stira Sara Mrudhu Kathina Vishada Pichila Laxana Khara Sukshma Stula Sandra and Drava are the 20 Guruvadhi gunas mentioned by the Charaka. And according to Vagbhata, Gurur Manda Himasnigda Laxana Sandra Mrudu Stiraha Gunaha Sa Sukshma Vishada Vimshatihi Sa Viparyayaha. So what are the gunas here mentioned are 10 gunas, and another 10 gunas are there which are viparya, opposite to this, or considered as a 20 Guruvadhi gunas. And according to Sushruta, firstly he mentioned first 4 pairs he mentioned with the antagonist, whereas he added some more new gunas. We will see now. Guru Laghu Manda Tikshna Shita Ushna Snigdha Ruksha Slakshna Sandra Drava Mrudu Sara Stula Sukshma Vishada Pichila, and added Karkasha Sukhanda Durgandha Vyavai Vikasi and Ashukari for the Guruvadhi gunas. Whereas remaining authors, these Karkasha Sugandha Durgandha Vyavai Vikasi Ashukari will comes under the priorly mentioned Guruvadhi gunas only. That's why they haven't mentioned particularly these gunas again. Then by detail we need to study about all these Sharirika guna, mainly because of our treatment science is based on the Samanya and Vishesha Siddhanta. So decrease in the body, give the similar quantities, similar guna, then it will increase. Or else if there is an increase in body, any kind of a dosha or any kind of a bad thing is increased in the body, so give the opposite thing, then it will decrease. So to maintain the equilibrium, we need to supply the nutrition, or we need to give the Sharirika gunas which nourishes the body. So those are present in the Sharirika gunas. We will see now. First one, Guru Guna, that is nothing but the heaviness. What Hemadri commented, Yasya Dravyasya Brahmane Karmani Shakti Sa Guruhu. The one which nourishes, one which increases the bulk of the body is nothing but the Guru Guna. So what is the Panchabhautikatva of this Guru Guna? Aap and Prithvi Mahabhuta. These Guru Guna Dravya are mainly composed of Aap and Prithvi Mahabhuta. And what the karma they will does? Dosha karma. How they will affect the doshas? Kapha Vardhana and Vata Shamaka. Because of the Gurutva of Kapha, similarity, it will increases the Kapha. Because of the oppositeness, it will decreases the Vata. Dhatu karma, Dhatu Vardhaka. Because of a Brahmana karma. Mala karma, it will does the Mala Vriddhi. And if we consider other karmas, it will does the Brahmana, that is nourishment. Balakaraka provides the strength, and Lepana, it provides the coating or anything. If something injury is occurred or cut is occurred, then it will heal it. So what are the dravyas? Shatavari, Masha and Aragvada. So where we need to indicate this? Vataja Vyadi in Krusha person, if a person is debilitated by the weakness or Panduroga or the decreased hemoglobin or decreased malnutrition conditions or a hair fall condition, in that condition we need to prescribe the Guru Guna Dravyas, nothing but the Shatavari, Masha and Aragvada. So next comes the Lagu Guna, lightness. Yasya Dravyasya Langhane Karmani Shakti Sa Laghu. The property which imparts the lightness to the body is nothing but the Lagu Guna. So what is the Panchabhautikatva composition? Agni, Vayu, Akasha Mahabhuta. All are Urdhvagami Mahabhutas. So what are the karma? These Lagu Guna does. Dosha karma, Vatavardhaka. Dhatu karma is Kshaya. It does the Kshaya of a Dhatus. And Shoshaka, it does the emaciation. Mala karma is Malakshaya Karaka because of a lightness. Anya other karmas like Langhana, Lekhana and Ropana, it heals the ulcers or it scrapes the excessive fat or a bad cholesterol in the body, and it does the fasting or it regulates the metabolic activities. And what are the dravyas? Mudga, Dhadima and Patola. Where we indicate these or indications, Kafaja Vyadi in excessive Staulya condition or in so heavy urination is going to take place, then just give a Dhadima, then it will act as a Grahi. And now comes the Mandaguna, nothing but the slowness. Yasya dravyasya shamane karmani shaktihi sa mandaha. Because of the slow activity or because of a slow action, it does the shamana, it does the shamana pacification of the any aggravated factor inside the body. So any alpa dosha dushana is there, where we usually prescribe a shamana aushadis, not a shodhana therapy, then we need to indicate the mandaguna dravyas. So what is the panchabhautikatva? Aap and Prithvi Mahabhuta. So what are the karma these mandaguna does to our body? Dosha karma is Kapha Vardhaka and Vata Pitta Shamaka. Dhatu karma is Dhatu Vardhaka. Mala karma is Mala Stambhaka. And Anya comes the Shamana, that is nothing but the pacification. So what are the dravyas? We will act as a mandaguna, Guduchi and Ativisha. Usually in a fever condition, we will prescribe the Guduchi, which subsides the fever in within 3 hours. And Ativisha is also very good tablet to prescribe, and where we indicate it, Dosha Shamana Arta and in Krusha person and Durbala person, where the person is not able to take the Shodhana therapy, he is not so fit for a Shodhana therapy, and we need to prescribe the Mandaguna Dravyas. Next is Tikshna Guna, sharpness. Yasya Dravyasya Shodhane Karmani Shaktihi Sa Tikshnaha. The property which possessing the sharp and penetrating activity is nothing but the Tikshna Guna. Shodhana, it does the Shodhana or expulsion of the vitiated dosha outside the body. So what is the Panchabhautikatva? Agni Mahabhuta. What is the karma? Dosha karma is Pitta Kara. Dhatu karma is Dhatu Kshaya Kara. Mala karma is Mala Pravartaka. And Anya karma? Shodhana, Pakakara, Shravana and Lekhana. The dravyas are like Pippali, Maricha, Bhallataka and etc. So where we indicate this, because of it is having Pittakara karma and Mala Pravartaka karma, in the indigestion or the excessive constipation is there, then we need to prescribe these kind of or Agni Mandya is there, then we need to prescribe a Tikshna Guna Dravyas. Also in a Bahudosha Dushana and Shodhana therapy, and for the Pachana of the Ama, we need to prescribe Tikshna Guna Yukta Dravyas. Next is Hima or Shita, that is coldness. Yasya Dravyasya Stambhane Karmani Shaktihi Sa Himaha. So what is Hima? The one which obstructs and imparts the coldness to the body is nothing but the Hima Guna. What is the Panchabhautikatva? Aap and Vayu Mahabhuta. So what are the karma these Hima Guna does to our body? dosha karma is pittahara, dhatu karma is dhatu vardhaka, mala karma is mutrala, svedhavarodha, and other karma if we consider prinana, radhana, daha, murcha, trishna, prashamana. The dravyas are like chandana, ushira and etc. So indicated in kushta vyadi because of the excessive pitta only the kushta or any kind of a skin ailments will produce in a body. So when we indicate these kind of a chandana asava or ushira asava and all in the patient who complains about acne and pimples and all, then it will subside because of the pittahara karma. And atisveda, some the obese people or some people will complain the excessive sweating with a bad odor, then we need to prescribe this himaguna yukta dravyas. And excessive burning sensation, usually in the summer there will be a burning sensation in all over the body or in palm and sole also there will be a excessive burning sensation in that conditions, or somebody is falling unconscious oftenly, and trishna because having the excessive thirst, and dagda vruna and burnt wounds and all, we need to prescribe these kind of a dravyas. Ushna, that is hotness. Yasya dravyasya svedhane karmani shakti sa ushnaha. The property which produces a coldness is the hima, whereas the one which acts as a thermoregulator in the body is nothing but the ushna guna. So what is the panchabhautikatva? Agni. And karma, dosha karma is pitta vardhaka, dhatu karma is dhatu kshaya karaka, mala karma is sveda janana and mutra kshaya, and anya karma is deepana and pachana. When it comes to the dravyas, the example like pippali, maricha, hingu and shunti indicated in jvara because of the present in the ama, because of the presence of a ama, it will cause the jvara. So there will be obstruction of a svedavaha srotas, there will be a lack of a sveda. So it acts as a sveda janana, by that it subsides the jvara. And ajirna, because of having the Deepana Pachana property, it acts as a Ajirnahara, Agni Mandhyahara, Amahara, and Sandishota, because of having the Agni Mahabhuta predominance, it will decreases the swelling, and any kind of a Vata Kafaja Vyadi, we can prescribe a Ushna Guna Dravyas. Next comes the Snigdha, that is nothing but the anctus or oiliness. Yasya Dravyasya Kledhane Karmani Shaktihi Sa Snigdha, the property which produces the unctuousness in the body. If a patient complains about excessive dryness or excessive in a winter season, usually the skin go into the dryness, or there will be a breakage of a skin, or vipadika, we will say that cracked soles, and they will cracked soles will be there. In that type of the condition of a patient, we need to prescribe a snigdha guna yukta dravyas. So it is the panchabhautikatva, apa and prithvi mahabhuta. Karma, dosha karma is kapha vardhaka, vata pitta shamaka, dhatu karma is dhatu vardhaka, mala karma is it produces snigdhata and ease out the defecation. So in difficulty in defecation or constipated conditions, we can prescribe snigdha guna yukta dravyas. Usually the people will say that when anybody complains about constipation, then everybody will say that eat one banana, because of having a snigdha guna, it will ease out the defecation. And anya karma like kledana, snehana, mardhava, palya, varna and vrishya. As usual, snigdha guna will provides the complexion, and it does the bala vardhana, and it acts as a vrishya also. So what are the dravyas? Eranda, devadharu, manjishta will act as a snigdha, and etc. are there more number of a snigdha guna dravya are there. And where we need to indicate this? Vata vyadi. In vata vyadi, because of the excessive vata, there will be a parushata or everything dryness will be there. So in order to subside them, we need to give a snigdha dravyas. In constipation and also in a skin ailment, because of the excessive dryness, there will be a pimples will occur. Where the pimples will occur, if we provide the proper moisturization to the any kind of a skin, then there will be no occurrence of acne will be there. That next is the ruksha guna, that is nothing but the dryness. Yasya dravyasya shoshane karmani shaktihi sa rukshaha, the one which does the shoshan of a body part or does the dryness of the body part will nothing but the ruksha guna. So what is the panchabhautikatva? Vayu. And karma, dosha karma is vata vardhaka, dhatu karma is dhatu shoshaka, mala karma is mala shoshaka and also stambhaka, anya karma like katinyakara and parshakara. So dravyas like vidanga and apamarga indicated in where the dryness is indicated, where in the condition like excessive kledatva will be there in ulcers or in a wound, usually in a wound. For that we need to create on dry environment to heal the wound properly. So that's why ropana, it does the vruna ropanartha, we need to indicate that. And people with the excessive oily skin may take the ruksha dravyas, or it also acts as a kriminashaka because of the kledhatva, the krimis will occur in the body, worm infestation will occur in the body. If we provide the dryness, then there will be no worms. So kriminashanartha, we need to prescribe a ruksha guna yukta dravyas. Next is this Laxana, that is nothing but the glossy. Yasya dravyasya ropane karmani shakti sa slakshna. The one which nourishes or one which provides the lubrication is nothing but the Lakshana guna. Pancha bhautikatva is Jala and Akasha Mahabhuta. Karma, like dosha karma is kapha vardhaka, dhatu karma is dhatu vardhaka, mala karma is mala pravartaka and help for easy defecation and micturation, and anya karma is like ropana for a healing, jivana, it provides the satisfaction or provides on well nourishment to the body, brahmana, it provides the strength to the body. So what are the dravyas? Like vikranta, pravala and mukta. Vikranta is nothing but the vaikranta, indicated in vrunaropanartha. Khara, that is nothing but a rough. Yasya dravyasya lekhane karmani shaktihi sa kharaha. The one which scrapes the body elements, one which scrapes the dhatus of the body is nothing but the karaguna. So when it scrapes, it's nothing but it should be indicated in a high cholesterol level in obese patients. So what is the pancha bhautikatva? Prithvi and vayu mahabhuta. What the karma it does? Dosha karma is vata vardhaka, dhatu karma is dhatu kshaya karaka, and anya karma like lekhana is nothing but the scraping, indicated in medacha roga. Any kind of a medacha rogas and arbuda, granthi or granthis will be there will be a formation of nodules and nodular formation will be there. In that condition we need to prescribe the karaguna yukta dravyas. Next is the sandra, the compactness. Yasya dravyasya prasadhane karmani shaktihi sa sandraha. The property which provides the proper compactness to the body is nothing but the sandra. Nowadays, because of the lack of a nutritional food or there will be a no protein rich food, that's why there will be always decreased hemoglobin will be there, and bone tissue deficiency, calcium deficiency and nutrition deficiencies causing very highly. So in now present era, we need to prescribe for any kind of a disorder a sandra guna yukta dravyas. That's why it provide the strength or a malnutrition or any kind of anemic patient if complains, then we need to prescribe a compactness or a sandra guna yukta dravyas. So what is the pancha bhautikatva? The prithvi is the pancha bhautika sanghatana, and karma like dosha karma is kapha vardhaka and vata shamaka, dhatu upachaya it will does, and mala karma is mala sandrata, and anya karmas like prasadhana or bandhakaraka it will does. And dravyas are like vidhari kanda and mushali, the one which provides the proper nutrition, one which increases the compactness of a body are nothing but vidhari kanda, mushali, shatavari and amalaki, everything will comes under this kind of a category. And where we can indicate it in weakness, in decreased BMI, if a person is not having some, we will see the persons like stature, very long stature will be there, very high stature will be there, there is a lack of a muscular body. So in that condition we need to prescribe these kind of a dravyas. And krusha person also, if a patient complains about the sexual unsatisfaction or sexual incapacity, that he is not able to satisfy his partner, then we need to prescribe these kind of a dravyas. Next is a drava guna, liquidity. Yasya dravyasya vilodhane karmani shaktihi sa dravaha. In the body, the quality which causes the liquidity is nothing but the drava guna. So what is the pancha bhautikatva? Obviously jala. And what is the karma it does? It does dosha karma, it is pitta kara. Dhatu karma is dhatu kshaya karaka. Mala karma is mala shaitilyata it does. Anya karma like vilodana, prakledhana vyapti, reason for the spreading and all. Dravya is like ikshurasa and kshira. Where we will indicate these kind of drugs in urine retention, there will be a no proper micturation if a patient complains. Then we need to prescribe the ikshurasa, it will cause the urination proper. In constipation, then we need to prescribe a milk, then it will cause the virechana. It acts as a virechana and cause the constipation clear. And mrudu guna, softness. Yasya dravyasya shlathane karmani shaktihi samruduhu. The property which causes the looseness and provides the softness to the body organs is nothing but the mrudu guna. What is the pancha bhautikatva? Pancha bhautikatva is apa and akasha mahabhuta. Karma, what is the karma it does? Dosha karma is kapha vardhaka, vata pitta shamaka, dhatu karma is dhatu shaitila karaka. It provides the looseness to the dhatus, or any kind of a obstruction is there, there will be a stiffness is there, then we need to prescribe these kind of a guna yukta dravyas. And mala karma mrudukaraka in constipation, anya karma like dahanashaka it will does, or parushatahara will be there. Dravyas like goduma and ht madhu we need to consider here. Many more are there. Indication is softness to the skin and hair and body parts, organs it will provide. And katina, hardness. Yasya dravyasya drudhikarane karmani shaktihi sa katinaha. The property which does the strengthening, which provides the strong firmness to the body is nothing but the katina guna. Panchabhautikatva is prithvi, and dosha karma is vatakara, dhatu karma is dhatu drudhikarana and katinya karana, and mala karma is mala katinyata, it causes the constipation. Don't prescribe in an excessive manner. Anya is like drudhikarana and sanghatakara, it will upachaya does the well built of a body. And dravyas like shanka, pravala and shukti, where we will indicate in a calcium deficiency and muscle cramps. If a person is having a calcium deficiency, then muscle cramps will be there. And if somebody is having balancing disorders, where age old persons can't balance their own body, then we need to prescribe these kind of a shanka, pravala, shukti dravyas. And sthira, firmness, the one which provides the strong firmness or steadiness to the body. So yasya dravyasya dharane karmani shaktihi sa sthiraha, the one which does the dharana or proper holding of the body is nothing but a sthira guna. Panchabhautikatva is nothing but a prithvi mahabhuta. Karma, dosha karma is kapha vardhaka, vata shamaka, dhatu karma is dhatu vardhaka, mala karma is mala stambhaka, and anya is nothing but the dharana. So what are the dravyas? Kadira, babula and etc. Where we will indicate it? Stambhanartha. If something excessive is bleeding in our body, something excessive is flowing in our body, then we need to prescribe a sthira guna dravyas. Like in babula is prescribed in excessive adhyatma, that is nothing but a heavy menstruation bleeding. In that condition, we need to prescribe these kind of dravyas. Next is sara, flowing. Yasya dravyasya prasarane karmani shaktihi sa saraha. The one which spreads, reason for spreading is nothing but the saraguna. Panchabhautikatva is jala, dosha karma is vatakara, dhatu karma is dhatu kshayakaraka, mala karma is mala pravartaka. So in the conditions of constipation, we can prescribe it. Anya karma like prasarana, anulomana it does. Dravyas are nothing but the haritaki and trivrut. Both are for the virachanartha, purgation purpose, and indicated in constipation and skin disorder. Purgation is a pitta. When there will be a pittaja impairment is there, then there will be a production of a skin disorder. What we will indicate? So pitta involvement is there, then we will definitely do a virachana. So these saraguna dravyas will indirectly or directly affect the skin disorder. It promotes the healthy skin, and indicated in constipation, all GI tract concerned disorders, we will indicate the saraguna dravyas. Next is sukshma, that is nothing but a subtle or a minute. What is the definition? Yasya dravyasya vivarane karmani shaktihi sa sukshmaha, the property which is subtle and has the capacity to penetrate even through the minutest channels of our body. And what is the panchabhautikatva? Agni, Vayu, Akasha Mahabhuta. Mainly Akasha Mahabhuta because of this Sukshmatva. Karma is nothing but the dosha karma, vatakara, kafahara, dhatu karma is dhatu kshayakaraka, mala karma is mala kshayakaraka, anyalak vivarana, that is spreading, vaishadhya is sukshma chidra, it will spread even in the minute channels of the body. So dravyas are like madhya, madhu and tila taila are usually indicated in vamana karma, and in hair fall tela tela is indicated. So if you want a success or a quick result to your treatment, then indicate these kind of drugs. Madhya is nothing but the asava and arishta. So asava and arishtas will have a very quick penetrating activity, so that the disease will subside in very little hours. And madhu, in any kind of a churna or any kind of the powders or tablets you will prescribe, just add a adjuvant as a madhu. It will enhances the absorbing, or it will reaches the drug into the target organ. And tila taila, when tila taila is the very penetrative and very penetrative action it has, Vyavai Vikasi action it has. So indicate those things in a prescription, then it will cause the success of the treatment. And stula, bulky. Yasya dravyasya samvarane karmani shaktihi sa stulaha. The property which increases the BMI or nothing but the increases the bulk of the body is nothing but a stula guna. Panchabhautikatva is prithvi, and karma is like dosha karma is kapha vardhaka vata shamaka, dhatu karma is dhatu vardhaka, mala karma is does the mala utsarga, it ease out the defecation or any kind of a natural urges. Anya karma like samvarana, staulya karaka, deha srota avaroda, it obstructs the srotas. And dravyas like dadi, pishtana and kadali phala, one abhishandi guna yukta dravyas are nothing but the stula dravyas, and indicated in krusha person, where a person want to have a bulk in his body, there we need to prescribe these kind of dravyas. Next is the vishada, the clear. Yasya dravyasya kshalane karmani shaktihi sa vishadaha. The property which clears of anything obstructed in the body is nothing but the vishada guna. So it is the panchabhautikatva, prithvi, vayu, agni and akasha mahabhuta. And karma, dosha karma is kafahara, vata kara, dhatu karma is kshaya and lekhana. Mala karma is mala shoshaka. Anya karma like kshalana, that is clearance. Kledha chushana, the dryness of this kleda, excessive kledatva in a body. Ropana, healing is the functions of the vishada guna. And dravyas are nothing but the nimbha, kshara, gugulu. Usually we will prescribe in a vruna ropanartha, amavata, and for in arsha and all, there will be a nodules, or there will be a, if there is a any kind of a tumor is there, then we need to prescribe the vishada guna yukta dravyas. Next is the pichila, slimy or a lubricant. Yasya dravyasya lepane karmani shaktihi sa pichilaha. The one which provides the coating inside the body is nothing but the pichila. Panchabhautikatva is aap, karma is like dosha karma is kapha vardhaka and vatahara, and dhatu karma is vruddhi and brahmana. Mala karma is malotsarga, because of a pichilatva it provides the mardhavata to the mala. And anya like lepana, pranadharana and balya. Dravyas like shalmali, shleshmataka, which provides the sliminess, which provides the oiliness to the body, are nothing but the pichila guna yukta dravyas indicated in a bhagna condition, or a bone fracture, or any kind of a fracture is there, then we need to indicate a pichila guna yukta dravyas, especially shleshmataka or shalmali. Next comes the paradi gunas or a chikitsa upayogi gunas. How many are there? 10 are there. What are those? Paratva, aparatva, yukti, sankhya, sanyoga, vibhaga, prutakatva, parimana, samskara and abhyasa. So paratva, tacha paratvam pradhanatvam. Chakrapani quoted that. Tacha paratvam pradhanatvam. In any kind of a thing, if two elements are there, then which one will be the prior prime one? That is nothing but a paratva. Which one will be the lower one? That is nothing but the aparatvam apradhanatvam. One which is inferior is nothing but aparatva. One which is superior is nothing but the paratva. So what is the use of this paratva and aparatva? This factor we will use as a desha, kala, vaya, mana, paka vishesha, paratva and aparatva. Like, if we need to decide in under the two dravyas, we need to decide which one is superior and which one is inferior. In that condition, this guna will be useful. So, what is the paratva and aparatva for our treatment useful? Desha. In desha, jangala desha is para and anupa desha is apara. So, jangala desha patients will be very healthy, whereas anupa desha patients will be very, immunity will be a little less. And kala, visarga kala is paratva and adhana kala is apara. In vaya, when it comes to the age, the young age is a para, or taruna is a para, vruddha is apara. Mana is prakrita sharira, the healthy body is paratva, and vikrita sharira or vikara is aparatva. Paka, virya, rasa are yaugika. If they are in accordance with the intaked ahara, then it is paratva. Ayaugika, then it is aparatva. Prakriti, if a roga is occurred, if that roga is opposite to the prakriti, then it is para. If it is similar, it will cause very chronic condition, then it is apara. Bala, the pravara, in the uttama bala is paratva, and avara, that is less bala, is nothing but aparatva. So next is Yukti. Yukti is nothing but the proper planning does for anything. When it comes to our medical field, the proper planning adopted for the treatment of for the treatment purpose is nothing but the yukti. Yuktischa yojana yatu icchate. The proper planned treatment is nothing but the yukti. So what is the importance of this yukti then? Yogadapi visham tikshnam uttamam bheshajam bhavet. Bheshajam chapi dhuryuktam tikshnam sampadyate visham. The proper planned utilized visha will act as a nectar and it cure the disease like a uttama bheshaja, the good drug. Even though the improperly used bheshaja or improperly used good medicine will also act as a visha. So there will be a very importance. The importance here is yukti. The proper planning is very important. So this is the importance of the yukti in our treatment science. Next is the Sankhya. Sankhya is nothing but the Sankhya Sad Ganitam. The numericals which we will use are nothing but the Sankhya. So example like Tridosha. We will say that dosha are there in our body. How many? 3. This 3 will matters a lot. That's why Tridosha, Saptadhatu and all are nothing but the Sankhya. To measure the any quantity of during the various pharmaceutical procedure and to fix the dose actually. If we advise the Rasa Shastra drugs, then in a high dose and all, it will cause the death of a patient. That's why the dose, for the fixation of a dose also, Sankhya is very important. Samyoga. Samyoga is nothing but the union or mixture of a 2 or more things. Yogaha saha samyoga uchyate dravyanam dvandva sarva eka karmajo anitya evacha. Union of 2 or more substance is nothing but the samyoga. How many are there? How many kinds of samyoga are there? 2 types, nitya and anitya. Nitya is nothing but the eternal, it can't be separable. Anitya can be separable. 3 purposes. How many purposes we are doing the samyoga? Dvandva karmaja, sarva karmaja, eka karmaja. Dvandva karmaja nothing but the for healing up of the pimples we are indicating the Gruta Kumari Svarasa with the Haridra. Then we have 2 ingredients, we are mixing it, and what purpose we are doing? And for the healing of the pimples, both will act as a aushadha here. So dvandva karmaja, both have a action towards one single destination. Sarva karmaja. Now Trikatu churna or Trikatu churna usually in Kasa patient in excessive cough condition we will prescribe. So all the 3 dravyas together act as a kasahara. So sarva karmaja. Eka karmaja. In a sandishota, or any kind of a swelling is there, a patient complaining of swelling, then we will place a erandapatra, that's nothing but the erandapatra over the swelled part, and over that we will tie it by a bandage. So here we are doing a union of a bandage and the erandapatra. But here only erandapatra has the anti-swelling, anti-inflammatory activity, whereas this cotton is only because of the helping purpose. That's why it is eka karmaja. Vibhaga, antagonist to the samyoga. Division of any samyoga is nothing but the vibhaga. 3 types are there. Vibhagastu syat vibhakti, syat viyoga, and bhagashograha is nothing but the 3 types of a vibhagas. Next is a prutakatva. Prutakatva is the specificity of any kind of a material. Uniqueness of a dravya is nothing but the prutakatva, which shows that this dravya or this thing is different from this thing, which differentiate it the one thing from the others. Example like amalaki is different from haritaki because of the having the prutakatva to the amalaki, it is different from a haritaki. And parimana parimanam punarmanam, the measurement is nothing but the parimana, aids in the measurement like anu dirgha hrsva and all. And like we are doing a surgery or like appendicitis is occurred in a patient. So how much the appendix is grown up and how much we need to cut and how much the incision we need to take, for all those things we need to do the measurement. That's why parimana is very important. Next is the samskara. Samskara is nothing but the processing of a dravya or processing for anything. Samskaram karanam matam. Various methods adopted for a processing of a dravya are nothing but the samskara. So what is the importance? Samskarohi gunantar dhanam uchyate. We have 18 samskaras for a farada to convert it from the higher metal to lower metal to higher metal. To convert it parada into the gold, we have a 18 samskara. When used for a deha for using the parada as a amrita itself, then we have 8 samskaras to increase its potency to cure the disease or to act as a nectar. So this samskara will cause the increase of a potency of the particular dravya. then it is very important to adopt a samskara for a dravya. Samskaro hi gunantardhanam uchyate. What are the different kind of a samskara? Shaucha, that is nothing but the cleaning. Manthana, that is nothing but the churning. Bhavana, what we will give. And bhajana, are many more are there. These are the samskaras. Next is abhyasa. The regular practice is nothing but the abhyasa. Bhavya abhyasanam abhyasah shilanam satata kriyaha. The particular thing which we will do on a repeated basis is nothing but the abhyasa, which is very important in case of a patya ahara sevana and all. Vaisheshika guna. Next comes third category. Vaisheshika guna are nothing but the indriyartha gunas. How many are there? 5. Shabda, sparsha, rupa, rasa, gandha. So Shabda guna, Indriya is the Shravan Indriya, Mahabhuta Adhikyata is Akasha. Where it is helpful or how could we use it in a treatment? For example, in Rasakshaya condition, there will be a lack of a Rasa Dhatu inside the body. So there is a symptom in a patient that Sabda Sahishnuta. He can't able to tolerate any simple kind of a sounds, and he will shout at any sounds if occurred. So because of the increased vata, he has a rasakshaya and a sahishnuta in his body, and decreased kapha will be there. So what we will do? Vatahara dravya we need to give, like shira, gruta, dashamula, arishta we need to indicate in that patient, and nourishing property having dravyas we need to give, then that the condition will relieve. So like this we need to use these kind of gunas in a treatment. Next comes the sparsha guna. Sparsha guna, indriya is the sparshanendriya. Mahabhuta adhikyata is vayu. So in vata vyadhi, usually there will be a parushatva in a body. In paralysis patient also we will do abhyanga because of retaining or regaining the elasticity of the skin, elasticity of the muscles. So sparsha guna is hampered. So vata vyadhi abhyanga with the oils will decrease the vata in the body and causes the healthiness. And rupa, third guna, chakshurendriya and agni mahabhuta. So for the assessment of a different coloration, the cyanosis or a pale color discoloration will indicate by these guna. Rasa, rasanendriya, mahabhuta. Usually in the jwara, aruchi will be there. Hampering of the ruchi will be there. There will be a kashaya asyata or katu kasyata will be there. In that condition, tikta rasa property is swayam arochishnum arochakagno, itself having no proper or no good taste, but it will cause the tastelessness. That's why we need to indicate the tikta rasa dravyas. Gandha, granendriya and prithvi mahabhuta. Usually in an unconscious patient, sangnya stapana mahakashaya dravyas or a tikshna dravya we need to hold at the nose of a patient. If a patient falls unconsciousness, so quickly what we need to do, just we will take the palandu or nothing but the onion, we need to crush it, or a few 2 drops of the juice of the onion. If we put it done the nasya karma, then the patient will regain his consciousness within a seconds. And in a nausea, usually in a vomiting sensation, we will prescribe panchapallava churna, or we will usually smell the ela or like cardamom or lemon and all. It will useful to subside them. Next is the Adhyatmika guna. Adhyatmika guna are the Atma guna, the qualities possessed by the soul. Those are iccha, the desire to acquire anything, dwesha, that is hatredness towards anything, sukha, the happiness, dhukha, the sorrow, prayatna is the different kind of a trials, the atma, what the person will do, buddhi, the intellect. So what is the iccha? Eshanam iccha, desire to have any, to acquire or possess any object is nothing but the iccha. How to use it? Like how we need to have these atma gunas to attain the health, we need to have a iccha. Dwesha, prajvalanatmako dwesha, aversion towards any work or anything or anybody is nothing but the dwesha. And this prajvalana is nothing but it produces the jwalan or burn, it causes the burning to the own's body and destroy him only, not other. The one who he will hating, it doesn't cause any harm to him, it will cause harm to himself only. And use in treatment, like towards apatya, we need to have the aversion. Obviously we need to have aversion towards the apatya. Next is the sukha. Sarvaisham anukhula vedhaniyam sukham. Favored situation occurred in a life are nothing but the sukha. so has to adopt a patyahara, it will provide a sukha. Next is dhukha. Dhukha, adharmajanya pratikula vedhaniyam guno dukkham. Opposite things occurred in a favor of a patient's or a person's iccha are nothing but the dhukha. Used in treatment like apatya is dhukha. And prayatna, kritihi prayatnaha, continued effort to achieve a goal is nothing but the prayatna to adopt in a life. It has to be adopted because of having any kind of a thing. We need to do a trial, different kind of a trial and error. Always our practice is nothing but a trial and error practice, because we will do the practice only. We will never be a doctor. We'll be a practitioner only. That's why prayatna is very important for us. Buddhi, buddhistu uha poha gnanam. The property which helps for the perception, analysis and comprehension of a thing or a matter are nothing but a buddhi, the intellect of that patient or a person, includes chetana, dhruti, smriti and ahankara. All these gunas or adhyatmika gunas are mainly helpful in a psychiatry branch, where we need to induce these gunas inside the patient, and we need to tell him what is good, what is bad, and how he should adopt in his life. And that's it for today's video about the guna concept.